Or what were you sort of problems you were trying to solve, and what you were thinking how this might help?
Sure. So our overall goal when introducing Florence was to capture three different cohorts. We were looking at patients who had uncontrolled hypertension, those who were not compliant with their medication regimen, and those who were titrating either on a new hypertension medication or titrating off.
Mhm.
When our office was first introduced to Florence during a meeting, the engagement to add Florence to our practice was purely provider driven. They immediately saw the benefit of having a digital nurse monitoring and engaging patients within the patients' homes as a major win for not only the patients and our practice.
Maybe you could talk a little bit about sort of the whole care team. You said your this was provider driven. Can you talk a little bit about who's in your practice, who are the clinicians, and was it sort of was everyone sort of on board there?
Sure. So our entire team became champions immediately. I have two medical doctors. I have two nurse practitioners on site, medical assistants, a care manager, and a support team. And everybody was really engaged in being able to accept Florence as being a really useful tool for our facility. Patients are reporting real ease of access using Florence as a text based service. They love the fact they don't have apps to download, they don't have to remember logins. That they really enjoy the fact that Florence is saving them time and money from having to come to our office site for blood pressure checks.
Hmm, that's great. So basically, there it's easy for them to use. As that all the folks that you've engaged and enroll in the platform, are they looking at their texts? Are they interacting with Florence?
So we are having 100% patient buy-in. I'm checking on. I'll pop on every morning and look, and patients are diligently doing their blood pressures, getting them in for us, um, and we're not having, or we haven't experienced any technical difficulties. So
Right. It is pretty easy when you don't have to download an app.
absolutely.
Talk a little bit about on the clinical team side. What's been the experience?
Yeah, so from our providers' perspective, they're really reporting that they're getting a clearer picture of what's taken place regarding a patient's hypertension in between office visits. So it's that gray area we all know is problematic. If you're having a patient seen every 2 months, this really captures all of that data in between. And so the providers feel like it's allowing them to make really better clinical judgments on those patients.
Do you have any examples of sort of a clinical situation where Florence was helpful in that decision making?
Sure. So I would probably go back to last week. Had a very nervous patient who was seen by the provider, really worried, about their blood pressure. They felt, that it was really out of control. We were seeing pretty consistent numbers here. Um, and we were able to meet with the patient, calibrate their blood pressure cuff, and send them home. And they've been sending in their readings, which are in line with what we were seeing here in the office. And so the patient called me yesterday and just said how relieved she was that, to be able to actually know that Florence was, giving her affirmations, motivations, but that her blood pressures were within the ACO, requirements. So it was a real win for the patient. She's less nervous, and it just allowed her to be at ease at home.
That's great. And a little bit about, so back to your sort of healthcare organization and your team. Obviously, there's value there in having additional information in between visits. Have you noticed anything else in terms of workflow? Has there been any other experiences from the entire organization or team that you've noticed?
Sure. So our practice immediately was able to see saved resources from using Florence. And that was right from our schedulers to our medical assistants and providers. They were all reporting that they were, able to see their resources were coming back. Um, and I think it's more so that we were having, patients calling concerned about their blood pressures. So it was touching our schedulers, and then the medical assistants were doing their blood pressure checks on the patients, and then the providers were having to, do that documentation piece, and meet with the patients. And now patients are really able to really monitor themselves at home with Florence. And so she's giving great messages to the patients in between their appointments.
Yeah. So you've been able to really sort of have benefit, not just with the nurses and the physicians and the nurse practitioners, but other members of the clinical team.
It's impacted in a positive way our entire practice.
I don't know if the providers or the clinicians in your practice are thinking about, oh, this is helping with hypertension. Where else might we find some additional opportunities?
Absolutely. So I know that, our team has developed a list of other opportunities that they want, everything from congestive heart failure, the whole diabetes management, all the co-occurring pieces. You're going to be able to, from what we've been able to tell with just our short term on Florence, that it's kind of there's no stopping the ability for what is available, and what we'll be able to see Florence build, that we can access as a program. So we're really excited, just to see what, the next programs coming out are going to be.
Great. Any final thoughts, Gemma, on the sort of the direction here and how we might expand the use and the opportunity and the value?
Yeah, absolutely. I mean, the beautiful thing about Florence is that she's incredibly flexible. We can basically build pretty much anything. And it's really all about behavior change. Thinking about those self-care behaviors that are going to keep people well, they're going to keep people informed, going to help them make better decisions about their care and keep them out of hospital. And if you can identify those behaviors that are important, then you can basically apply that to any long-term condition. And we know that a lot of long-term conditions, the balance of whether somebody is well or unwell will be dependent on the behaviors that they're performing at home when you can't do anything about it. But Florence can help. She can help the clinicians to understand which patients need more help, and she can also help the patients to look after themselves.